Today we are going to reveal a medical breakthrough in lupus disease. Lupus erythematosus, or SLE, is one of those diseases that's not always talked about, but for millions of people globally, it's a daily reality. Systemic lupus erythematosus is an autoimmune disease that affects various parts of the body, including the skin, joints, heart, brain, and kidneys. The pain, fatigue, and unpredictability can take over your life. In 2024, scientists from Northwestern Medicine and Brigham and Women's Hospital made a significant breakthrough in understanding and potentially treating lupus. The exciting part of the study is that drugs that activate the aryl hydrocarbon receptor, AHR pathway, could reprogram these malfunctioning immune cells, reducing the autoimmune attack that causes lupus. Chapter 1. What is lupus? Systemic lupus erythematosus, SLE, commonly known as lupus, is a chronic autoimmune disease that can affect multiple parts of the body. SLE is a condition where the body's immune system mistakenly attacks its healthy cells and tissues. This leads to inflammation and damage in many parts of the body. SLE affects women about 9 times more often than men, and most commonly occurs in people between the ages of 15 and 45. The disease is more prevalent in African Americans, Asian Americans, Hispanic Americans, and people of American Indian descent. If you or someone you love has lupus, you already know the toll it can take. Chapter 2. The breakthrough discovery. Identifying the cause. For years, doctors and researchers have pointed to a combination of genetics, hormones, even past infections, or environmental triggers like chemicals. At Northwestern Medicine and Brigham and Women's Hospital, scientists have discovered a molecular defect that promotes the pathologic immune response in systemic lupus erythematosus, SLE. The researchers identified an insufficient activation of a pathway controlled by the aryl hydrocarbon receptor, AHR, in lupus patients. This deficiency leads to an overproduction of disease-promoting immune cells called T peripheral helper cells, which contribute to the production of harmful autoantibodies. They've also found that a protein called interferon alpha, IFN-A, which is normally a defense mechanism, plays a big role in causing this imbalance. People with lupus have too much interferon. This excess messes up the body's ability to heal while fueling the attacks on healthy cells. Interferons normally help fight infection, but in lupus they become overactive, causing inflammation and damage. The exciting part of the study is that drugs that activate the AHR pathway could reprogram these malfunctioning immune cells. Chapter 3. Targeted approach to cure lupus. Why is this discovery so important? For years, lupus treatments have focused on broadly suppressing the immune system. While you suppress the immune system, you're also shutting down the immune cells that keep you healthy and fight off infections. Patients report that the treatments can feel as exhausting as the disease itself. Addressing this molecular defect, scientists found a promising way to potentially reverse the disease by activating the AHR pathway using small molecule activators and limiting the excessive interferon in the blood. Using targeted treatments can specifically reduce the number of disease-causing cells and potentially reprogram them into Th22 cells, which may promote healing from lupus-related damage. Dr. Jae-Hyuk Choi, Northwestern Medicine physician and scientist, one of the study's co-corresponding authors, stated, "By identifying a cause for this disease, we have found a potential cure that will not have the side effects of current therapies. While targeting the treatment, people with lupus might have fewer flare-ups, less pain, and more control over their lives." Chapter 4. What this means for you. If you or someone close to you lives with lupus, this could be the beginning of something life-changing. Researchers are already looking into new treatments, including a drug called anifrolumab, which is sold under the name of Safnalo. Anifrolumab is a human monoclonal antibody medication used to treat moderate to severe systemic lupus erythematosus. It works by inhibiting the action of interferon alpha, a molecule that plays a key role in the development of SLE symptoms. Anifrolumab is administered intravenously every 4 weeks and is typically used in patients who have not responded to other treatments. It has been approved in the United States and other countries for use in adults with active SLE who have a high level of interferon alpha in their blood. Patients who received this drug showed real improvements. Their immune systems started to rebalance, giving hope that someday soon, targeted treatments will be more effective. While it's the newest approved drug, other medications like voclosporin, or Lupkynis, were also recently approved for lupus nephritis in 2021. For people with lupus, this is more than just a scientific discovery. It's the promise of a better quality of life. This research is still in its early stages, and not everyone in the scientific community is ready to say this is the one-size-fits-all answer. Lupus is a complex disease, and more studies with larger groups of people are needed. There are nearly 700 clinical trials related to lupus treatments underway, indicating a robust pipeline of potential new therapies. But what's clear is that we're on the right path. Many of these focus on targeted approaches that affect only specific elements of the immune system's operation, aiming to provide more effective treatment with fewer side effects. This discovery might not be the final answer, but it's a big step forward. For those living with lupus, this is a moment of hope from the overwhelming symptoms of lupus. It's a reminder that science is advancing, that better treatments are within reach, and that one day we might live in a world where lupus is much more manageable. What do you think about this breakthrough? Let us know your thoughts in the comments. And don't forget to hit like and subscribe to Health Equals Wellness so you stay updated on the latest health breakthroughs.